Morning, everyone. Happy Thursday. Hope everybody's having a good week. Weekend's almost here. NBA starts up tonight. Excited. I'm a big NBA fan, basketball fan, so I've been missing sports a lot lately, so I'm super excited. Hope you guys will be tuning in too. We'll get started here in just a second. We're going to give some time for people to hop on. I'll be describing kind of some of the equipment that you guys will need today and what you guys can expect to in just a second. And then if you guys haven't registered for the workshop yet, I'm going to go ahead and drop a link in the comments so you guys can sign up if you haven't already. What I'll be doing is I'll be creating a list of exercises that we're going to go over today to correct some of the imbalances that we find. And by filling out the form, the first form's a liability waiver. Main thing is I don't want you guys self-diagnosing yourselves. Okay, this is just generalistic advice. Obviously, I can't do a full body assessment personally for everybody through Facebook Live, but I'm giving you guys some tools to help identify some of these restrictions that might be happening and what injury, if you're having pain with a certain area, what the injury could be. Again, it's not professional medical advice because I can't physically do an assessment. All right. So there's liability waiver I want you guys to fill out, and then also by filling out that you can put your email address in there too. And if you do, then I'll be able to send the exercises to you guys that we go over today. So you don't have to try and memorize these or anything like that. Okay. So that's in the comments there. So feel free to, if you guys could fill it out, that'd be awesome. And we'll get started in just a minute here. Okay, some things that you guys are going to need today: either a foam roller or a massage ball, a yoga mat, and try and make this as easy as possible with regards to equipment needs. I want to try and keep it minimalistic as possible for those that don't have a lot of equipment at home to use. Okay. We make huge changes, just as much changes without equipment as if we had equipment. All right, it's just all about modifications and whatnot. We'll be going over those today as well. Okay. So we'll go ahead and we'll get started. All right. So if you're thinking about progressing into higher levels of exercise, I know there's a lot. I mean, kind of before they kind of put more restrictions back on with regards to gyms, but I know there's a lot of gyms in the area that were starting to open back up with regards to outdoor classes. And I had a lot of my patients and other people reach out to me concerned about ramping back up into higher levels of physical activity, especially because they've been sitting around for so much more throughout the day because they're working from home. They haven't been as active, they haven't been as mobile, and they've been doing a lot of body weight exercise, and they're worried about transitioning back into weights, back into just higher level exercise, and worrying if their body was actually going to be able to withstand that increase in intensity and whatnot too. So what we're going to do is I'm going to take you guys through an assessment on the major joints and musculature of the human body, of where we've been seeing a lot of restrictions with our patients, and then also other people that have reached out, and just the nature of being less active and less mobile. There's areas in the human body that are just more prone to getting tight and leading to putting us at increased risk for injury for future exercises and whatnot too. So we're going to be going over that. So we're going to be taking a look at the shoulder joint. We're going to be looking at the low back. We're going to be looking at the hips. We're going to be looking at the knees. We're going to be looking at the ankles. Okay, all major joints to see do we have restrictions, and if so, how do we correct those restrictions or start making progress in the right direction so we can start getting back to working out the way that we want to and not having to worry about if our body's going to break down. Okay, so if that's what you're looking for, you're in the right spot. All right, that's what we're touching on today. A little bit about me. So you're probably like, who the hell's this guy? Why should I be listening to him? All right, so a little bit about me. I'm a doctorate of physical therapy, physical therapist. I also have my CSCS. I'm a certified strength and conditioning specialist. It's the gold standard of professional with regards to, like, for example, the NBA, the NFL will not let their players train with somebody that does not have their CSCS. All right, a lot of trainers have other certifications and degrees out there, but the most prolific athletes are not able to work with a trainer unless they have their CSCS. It's the gold standard. All right. So what my specialty is, and the other 3 physical therapists on my staff, We specialize in helping active adults in Oakland and the surrounding Bay Area get back to workouts and sports they enjoy without having to take time off or without injections, medications, or surgery. All right, big things we want to keep you guys moving while you go through the rehab process. A lot of times, if you go see a physical therapist or a physician, they're like, okay, we'll just just rest and then try again. That doesn't do anything. That's not treating the root cause. That's not doing anything. It's just going to come right back. Okay, you're going to feel better because you're not doing anything, but then when you try and ramp back into exercise, it's just going to go back downhill. Another thing I see a lot of PTs do too, and I'm not trying to knock on other PTs, but a lot of times when you go see a physical therapist, they're like, all right, just stop working out. You're not going to be able to work out for a month or two while we go through this rehab process. And that's not the right approach to do it. We need to make modifications to the activities that you're doing. We need to keep you exercising, keep you moving while we go through this rehab process. Because if we don't, then what's going to happen is the muscles that are weak already are just going to get weaker. And also the muscles that are strong throughout the body and the other joints, like such as the knees, ankles, and hips and low back, those are actually going to start atrophying, and then they're going to get weak, and then that's going to lead to injuries in those other areas that you might not actually be problematic right now, but they could be because you're not working out and they're not getting that strength. So it's super important to keep working out and exercising while you're going through the rehab process. Okay, a lot of people just rest, then retry, rest, retry. That's like one of the worst approaches to do. Okay. So we're located in Oakland, in uptown Oakland, kind of right across from the Oakland YMCA. For those that go to the Great Western Power Company in Oakland, we're like 3 blocks away from that. So super close. You guys are our neighbors. And we've done workshops on shoulder pain and I think low back pain as well for you guys before all the craziness started as well. So that's a little bit about us. All right, so enough about that. We're going to jump into some of the assessments. Okay, so what we're going to do is we're going to start down at the ankle, and we're just going to work our way up through the body. Okay, none of these should be painful. Should not be painful. Okay, it should be able to give you guys some good insight. You guys might notice some tightness or tension or lack of mobility, and that's what we want. We want those things to start popping up. If you guys are having pain, we want to start seeing things pop up, because if there's restrictions, that's great, because that means we can make significant changes. If we can make significant changes with regards to mobility and strength, then that's going to start translating into decrease in pain. Tell my patients all the time, if you come in, one of the worst things that can happen during assessment is you guys come in and we don't find anything that's wrong. Because if we don't find anything that's wrong, there's nothing to improve upon, and then that means we can't make a whole lot of changes with regards to the pain level. Okay, so it's actually good if you guys are having some pain right now. It's actually good that if we start finding some restrictions, then you guys can start getting some answers and some insight into your body and what's going on, and then how to address it as well. Okay, so let's start with the ankle. All right, so a lot of time people have started taking up running lately because a lot of the gyms are closed. So people are turning towards running to get stress relief and exercise, and that's leading to a lot of knee pain, hip pain, and ankle pain. All right, and a lot of times that knee pain is caused due to tight tissues and restrictions in the ankle joint. Okay, so it works its way up the chain. I'll be describing that in just a second. All right, so what I want you guys to do is I want you guys to find a wall. Okay, what you're going to do is you're going to take your foot. See how I did with the camera positioning? Not very good. Don't claim to be Martin Scorsese or anything here. But what we're going to do is we're going to take our foot, we're going to bring it up to the wall. We're going to try and take our knee and touch the wall, okay, without letting our heel come up. Our heel should not be coming up to allow us to touch the wall. If we start seeing that, that means that we're compensating, okay, and we're running out of areas, range of motion to work with, okay. And then if you guys could also put in the comments, first I'm going to backtrack a bit. If you guys could put in the comments whether you guys can hear me okay or not, that would be awesome. I don't want to go through this and you guys not be able to hear me. If you guys could put that, whether you can hear me or not, that would be awesome. And if you guys want to go ahead and start describing the types of pain that you're having, again, looks like we got a small group. I think we got 5 or 6 people on here today. If you guys can put in what you're having pain with, or what you're having difficulty doing because of the pain, and just when this happened, and kind of just a general overview of your injury and what you've been experiencing, I'll be able to tailor this to you guys a little bit more too. Okay, I've got my general layout of what I want to do, taking us to this full body movement. But if we got a bunch of people in here that everybody has knee pain, okay, I'm going to focus in on that. I'm not going to touch as much on the shoulder or vice versa. Okay, so I want to make this tailored to you guys. Okay, so if you guys can put in the comments whether you can hear me or not, and then also what type of pain or injury you're dealing with, and a little bit of background on that, that would be awesome. Okay, so put that in the comments while I go through this, and then I'll address that. Okay, so back to my point. We want to bring our foot up to the wall, toe up to the wall, heel flat on the floor. From there, we're trying to take that knee and driving it to that wall. Okay, everybody should be able to do that. Okay. So what we're going to do is we're going to go inch by inch back. Okay, so I'm going to bring my foot back an inch and retest and retry. Okay, don't let that knee come up. Okay, we should not be letting that knee dive in. Okay, we shouldn't be having that knee dive in or cave out. We want that knee going straight over that second and big toe. Okay, so what we're going to do is we're just going to go inch by inch back until we start running out of range of motion. Okay, also going to reposition this here a little bit better. Let's get some different angles here. Okay, so start here, try and touch, back an inch. Okay, and then we're just going to go back until we start seeing that heel lift up. Okay, so I'm good there. And this is about my restriction. You guys see how my heel's coming up now? Okay, that's about my restriction. So I'm about 4 or 5 inches away from the wall there, closer to 4, okay? All right, so you're gonna test one side, and then you're gonna also test the other side. Okay, inch by inch, until that heel starts lifting up. Okay, mine's starting to lift up a little bit right there. It's actually a little bit more restricted on my right side. Okay, PTs aren't perfect either. Okay, so tell you guys what the norms are there and how that, and you guys are like, okay, well, this is the results. What does that exactly mean? Okay, so ideally we want 4 to 5 inches away from that wall, especially if we're running or sprinting, or if we're doing deep squats. We need ankle mobility to do those exercises. Okay, that's what the research shows. We need 4 to 5. If we don't have 4 to 5 inches away from that wall, okay, we're putting ourselves at an increased risk if we're doing a lot of running and deep squats. Okay, and those compensations are going to start being seen and work their way up into the chain, into the knee, and the hips, and the low back, and then we'll start having breakdowns there. Okay, so a lot of times knee pain is actually caused due to limited ankle mobility. I take patients through an assessment all the time, and they're like, it's like past medical history, like broken bones, other past injuries, and everybody tells me like the bigger ones. Everybody forgets about ankle injuries or ankle sprains. And ankle sprains are just as important as other major injuries, because what happens is if we sprain our ankle, that tissue around that ankle gets really tight, because usually we immobilize it and we're not on it as much, and so those tissues in the ankle get really, really tight. Okay, and when they get really tight, then we never actually regain that range of motion. But the ankle feels fine. Okay, it's not hurting anymore, but that tissue is really restricted and really tight, and it's going to work its way up into the knee. And so a lot of times, if I dive in a little bit more about their past medical history for patients that come in with knee pain, they tell me that they have had ankle sprains in the past. Okay, and guess what? I look at the ankle, and usually 9 times out of 10, it's really restricted, and we free that up, and their knee pain actually decreases significantly. Okay, so it's not always one important piece I want you guys to take away from today. Just because there's pain at one joint does not necessarily mean that that's the reason for the pain. Okay, rarely ever is the knee actually responsible for the pain that it's experiencing. It's usually due to what's happening above the joint and the hip, and then also what's happening in the ankle. Okay, so it's important to assess, don't guess. All right, get an assessment done, figure out what's the root issue of this. Okay, I see a lot of people that have knee pain, so guess what they do is they hop on YouTube and they search best exercise for knee pain. And guess what? All YouTube's going to populate is exercises that addresses the knee. I just told you guys that a lot of times it's the ankle or the hip. And so sometimes those exercises actually make it worse, and they're not even treating the root issue. So you guys need to figure out what the root issue of things is. Okay? Sandra says, hearing you well. Awesome. Thank you, Sandra. Appreciate it. Perfect. Glad you guys are able to hear me okay. All right. And again, if you guys can put in what you're having pain with, that would be awesome. I'll be able to help you guys out more with that too. Okay, and just like the knee, that also plays, the same rules apply for the shoulder as well. Just because there's pain in the shoulder doesn't mean that it's actually the shoulder that's the issue. can be coming up and below the joint, can be coming from the neck, can be coming from the mid-back. Even the low back positioning influences our shoulder positioning and can lead to shoulder injuries as well, okay? So for normal walking pattern, we get back to the ankle mobility. For normal walking and gait or walking patterns, we need 3 inches away from that wall. If we don't have 3 inches there, what's gonna happen is we're gonna start having compensations that are happening in our gait pattern, okay? Our foot's gonna have to turn out. We're gonna also do other funky movements that are very subtle, but over time, they're going to lead into other issues up the chain or down the chain as well, okay? So ideally 3 inches away from that wall. If you're mainly just want to be able to walk without any deviations, 4 to 5 inches away from the wall if you're doing a lot of sprinting or deep squats. Okay, we're just squatting in general, really. Okay, so that's the ankle. Any questions on that, guys? Sandra says left knee. Okay, all right, Sandra. So ankle mobility is going to be really important. See if there's any discrepancy. Did you see any discrepancy between left and right when we did that testing? I would suspect that you most likely have limited ankle mobility in that left ankle as well, but not always. All right, but that's something that we see a lot. Okay, so next thing you guys are going to do is you're going to, once you guys grab a mat, I'm kind of happy to, not trying to make you guys dizzy here. I'm going to reposition back over to the mat area here. So once you guys do is grab a mat, what we're going to do is this is going to be a test for quad tightness and knee health. Okay? So what you're going to do is you can fold up a yoga mat. Position so you guys actually see that. Okay? So what you're going to do is you're going to fold over a yoga mat and you're going to go on both knees. Okay? And what you're going to do is you're going to slowly bring yourself back like this. Okay? And noticing, what do you guys feel here? Okay? A lot of times people feel that people that have knee pain will feel like there's a pretty intense stretch throughout the quads here. Okay? Toes should be tucked underneath. Okay? What you're just going to sit back into this, okay, and lean back. And if you feel a stretch here, it means that your quads are pretty tight. Okay? And that can lead to issues in the knee. Okay? I'm going to briefly go over that. I'm not going to go super in depth with the anatomy of it. But essentially, what happens if we have tight quads, it's gonna work its way into knee pain. Okay. The reason for that is we have our quad muscle, or quadricep muscle. Quadricep muscle attaches kind of up here towards the hip area, and it goes down and attaches at this kneecap. Okay. You guys see how it kind of looks gross? If you guys do the same thing, if you straighten out your leg and move your kneecap back and forth, okay, that quad attaches at that kneecap. Okay. And if that quad gets really tight, what's going to essentially happen is it's going to pull that kneecap up. All right. So if you guys watch my kneecap when my leg's straight like this is positioned here. As I bend my kneecap actually drops down to here. It's no longer sitting up here. It's actually down here. All right. And there's a groove that this kneecap has to travel in. Okay. Right through here. All right. And if the musculature is tight, either on the outside of the quad or the IT band area here, that IT band and that lateral quad also attach kind of at the side of the kneecap. What's going to happen is it's actually going to pull that kneecap off to the side, this direction, all right? And it's going to not allow it to track in that groove properly. And so anytime we bend our knee, okay, we're going to get increased rubbing on the outside and we're going to get some irritation and pain. Same thing if we have a really tight quad. This is rare that this happens, but it can. Okay, but it still can play a factor. If that quad is really tight, what will happen is actually not allow that kneecap to drop down into that groove. That's if it's really tight, and it's going to be really painful. Okay, even if it's not to that extreme, it will still allow it to drop into that groove. But because we have that tension, it's going to increase that compression of that kneecap, the underside of that kneecap in that groove. Okay? And it's going to cause some increased rubbing. You might feel some cracking and popping and whatnot, and that can be due to that rubbing of that kneecap between the underside of that kneecap and that groove, okay, leading to pain. Okay? So that's how tight quads can play a factor into things. Okay, and I'm going to give you guys exercise on how to address some of these restrictions as well. Okay, so if you notice quad tightness and you are having knee pain, there's a correlation 9 times out of 10 with that. Okay, all right. So that's something to consider. All right. Next thing I want to do is I want to look at the hip. Okay, what we're going to do for testing is also treatment as well. Okay, this what we do as PTs is we use treatment sometimes to rule things in, rule things out based on what's going on. So what you're going to do is you're going to actually go back to that mat, and what you're going to do is you're going to get into a half kneeling position. And half kneeling position, like so. All right, I'm going to start with my right knee down, and then what I'm going to do is I'm going to squeeze my right glute, pull my rib cage down, and then I'm going to shift my hips forward. Okay? If we have tight hip flexors, okay, this is a muscle that tends to get tight when we sit for long periods of time. You'll feel a pretty intense stretch here. Okay? So if you're having hip pain, and let's say you're having hip pain on the right side, we're going to test both left and right, and I want you guys to notice, do you guys feel the difference between left and right? Okay? So I want you guys to make a note on how intense it is on this right side, and we're going to switch and do the same thing on the left. Okay? So again, we're kind of in a 90-90 position here. Okay? Left knee's down, right leg's up. I'm squeezing my left glute, pulling my rib cage down, and then I'm shifting my hips forward. Okay? Do you guys feel a difference between left and right? Does one side seem tighter than the other? If you're having pain on the right side and you feel that this stretch is more intense on the right side as well, most likely this tight hip flexor is also contributing to some of that pain and tightness that you're feeling in that hip. Okay? So this is also how you treat it as well. Okay? You just maintain this position, squeeze the left glute, pull the rib cage down, and then you're shifting forward, and we hold this for ideally 30 seconds. Okay? And we do this 3 sets. For time purposes today, I want to get through as much testing and exercise as possible so you guys have stuff to work on. So we're only going to be doing 1 set. Okay, so you do 30 seconds here, and then also 30 seconds on the other side as well. Back foot should be tucked underneath like this. It shouldn't be like this. Tuck like this. Squeeze the right glute, pull the rib cage down, and then shift the hips forward. And you guys don't have to memorize this. I'm going to be uploading a routine into the group later of everything we go over. It's going to have reps, sets, written description, video description, so you guys don't have to try and memorize these, okay? You're not going to watch this on replay or anything like that either, okay? All right, so that's kind of how the hip, to start making progress on the hip flexors, okay? If you guys like wondering, like, well, why does the hip flexor, why am I so tight there, okay? The reason for that is a lot of times when people, if we sit for long periods of time throughout the day, especially like 8 hours, a lot of people are sitting at a desk for 8 hours a day, or with, a lot of people aren't commuting now, which is good, because a lot of people are working from home, but again, when we're commuting, we're also usually in a sitting position. And so that hip flexor attaches from up here down to here. And if we're in a sitting position, now that muscle is in a shortened position. The entire time that we're in a sitting position, that muscle is shortened, okay? And so what happens is, because it's in a shortened position, when we actually go to stand, okay, it's actually, some people might feel like they have to kind of walk around, like not like this to this extreme, but feel like they can't really stand up straight completely for the first minute or two when they get out of the chair, and that's due to how tight those hip flexors have gotten. Okay? Does that make sense, guys? So that kind of goes over the hips, all right? There's a lot of other musculature, don't get me wrong, there's a lot of other musculature in the body that can be restricting the knees and the hips and the ankles. But we're going over the main things that we've been seeing deficits with, and that's usually ankle mobility, the ankle tightness, quad tightness, and then also hip flexor tightness. Okay? Next thing I want to go over is a test to assess how strong your core is. Okay? And if this is contributing to any low back pain. Is anybody having low back pain that's tuning in today? Yeah, I can't help you guys unless you guys give me feedback. I'm just going through my usual routine unless somebody gives me some more insight of what their injury is. All right, so what you're gonna do is you're gonna grab a mat here, okay, and what we're gonna do is we're going to lay on our back. We're gonna bring our legs up, okay, in this position. What we're gonna do is we're gonna take our hands and we're gonna place those behind our low back. Okay, and what we're going to do is we're trying to push our low back into our hands. Okay, try and squish your hands against the mat with your low back. Okay, from there, what you're going to do is you're going to maintain that, push that low back in the hands, maintain that, and then you're going to bring your legs up. Okay, keep the pressure of your low back into your hands, and then you're going to slowly lower your legs as you breathe out. Okay, don't let the low back arch. Okay, we don't want that arch in the low back. Okay, we want to keep that constant pressure of the low back on our hands, pushing into the mat. Okay, again, release again. Okay, pushing the low back into the hands, into the mat, and then you're going to be lowering your legs nice and slow while you breathe out, making sure not to lose that low back position. Okay, if you start feeling yourself that low back arching, that means that core is not strong enough to stabilize the spine and the pelvis, and that can be contributing to some of the low back pain that you may or may not be experiencing. Okay? Again, there's a lot of other things just because that can be contributing to low back pain than just a weak core. A lot of the time there's other things that are going on. Such as a tight hip flexor can cause low back pain to change the orientation of the pelvis. A lot of other things can be going on. Again, just give you guys the basics of things that we've been seeing a lot. Alright? This isn't going to be an answer for everybody. Alright? Any questions on that, guys? Okay? So next thing we're going to do is we're going to go over shoulder mobility. Okay? A lot of times the lat, okay, the lat is a muscle that spans kind of right underneath by the armpit, and it goes down and actually attaches down the pelvis. Okay? And so this can contribute a lot to pain with overhead activities, okay? Or reaching overhead if this is tight. Because what's going to happen, it's not going to allow the shoulder to move like it's supposed to due to that tightness. So we're going to see if that's contributing to things. Okay, so what I want you guys to do is you're going to lay with your arms flat. Okay, what you're going to do is you're going to take your arms and you're going to try and reach above your head. I'm going to show you what a positive test would look like. Okay, ideally, you want to go all the way down to the floor. But this is what a positive test would be if there's lat tightness. Okay? Let's say this is as far as I can go. Okay? What I'm going to do next is I'm going to bring my legs up. And now you guys see how I'm going further. Okay? That's a positive test. I'll explain why in just a second. Alright, so again, keep your legs straight, and you're going to bring your arms close to the floor as you can, and see if you can do that. Alright? If you can get to the floor, great. If you can't, now what you're going to do is you're going to bend your knees, and see if you can go further. Again, you don't want to be trying to round out your low back here. Okay? You want to keep that in the same position. Pretend like you're trying to keep that low back pushed into the floor. Okay? If you're able to go further, once you bend your knees, that's a positive test. It means your lats are tight and can be contributing to some of the shoulder pain that you may or may not be having. You're like, well, how can what's happening down my knees be influencing what's happening at my shoulders? Okay? The reason for that is because, again, those lats tap from here down to the pelvis. As we bend our knees, it's actually changing our pelvis orientation. It's actually allowing the pelvis to tilt a little bit more and taking the tension off of the lats. It takes tension off the lats when my knees are bent. And if I take tension off the lats, then if my lats are tight, I'm going to be able to go further. Okay? If my lats are okay, and not tight, it wouldn't matter if my legs were bent or straight. Okay? That's why this test can be positive or indicative of lat tightness. Okay? All right. Last test for the shoulder. This is also another test for lat tightness. Okay. So what we're going to do is I want you guys to find a wall. Let me see here. I'm going to bring this over this way. Again, not trying to make you guys dizzy. I want you guys to find a wall. All right. And what you're going to do is you're going to come up to that wall. What you're going to do, as you can't do this because there's these things in the way. All right. But what you do is you want to try and bring your arms all the way back to the flat against the wall. Okay, your elbow should be in contact with the wall, your hand should be in contact with the wall. Okay? Your feet should be all the way back up against the wall as well. Just like we did with that low back exercise, we should be trying to push our low back into the wall. And then from there, what we're going to do is we're going to try and reach overhead, keeping our elbows and our hands in contact with the wall the entire time. If you guys start feeling like your arms are coming off, okay, or going forward, that's indicative of lat tightness and puts you at an increased risk for shoulder pain. If you guys notice that if you have to arch your low back and you're able to go further and do it, that's also indicative of lat tightness and future shoulder pain as well. Okay, so this means we need to loosen those areas up. Okay, so any questions on that exercise or that test at all, guys? So to recap, we went over ankle mobility, knee mobility, hip mobility, low back, core strength, and then 2 shoulder mobility exercises. Okay, so those are going to be that should give you guys pretty good insights into deficits that you may or may not be having. Okay, any questions on the assessment before we start to get into some corrective exercises for those? Okay, so it's super important to assess, don't guess, and these are going to give us some insights to that of what's actually going on. All right, so what we're going to do next is we're going to go over ankle mobility, okay, and some stretches that you guys can do. All right, again, there can be so many different reasons and causes for ankle tightness. Can be joint tightness, can be muscular tightness, can be ligament tightness, tendon tightness, lack of mobility at the bottom of the foot, the plantar fascia, so plantar fasciitis, stuff like that. Okay, so I'm going to go over some things that are going to address the calf tightness, okay, the muscular tightness, but it's, again, I haven't assessed you guys to see what area is tight and what's not. I'm just going on based on what I typically see. Okay, again, they should not be painful. If you have pain with these, stop. Okay, so what you're going to do is you're going to go find a wall, all right, and what you're going to do is you're going to bring this back leg, okay, plant it. It doesn't matter what this front leg is doing. Okay, what we're going to do is we're going to push into that wall, and we should feel a nice stretch in our calf. Okay, right back here. Should feel pretty good stretch. There's 2 calf muscles. There's the gastroc, and then there's also the soleus. Okay, one attaches above the knee, one attaches above the knee, one attaches below the knee. So we can manipulate which muscle we're stretching, whether this knee is bent or straight when we do the stretch. I have a lot of patients that come in and say oh, I stretch my calves out all the time, and I don't get any improvement on my ankle mobility. Okay, show me the stretch. Well, they just show me one of these stretches. They don't show me both. And so they're really only going after 50% of musculature, and it's no wonder why they're not making improvements on their ankle mobility. Okay, so they're only hitting 50% of the issue. Okay, so again, you should feel a nice stretch there in the calf. And you're switching to the same thing on the left. And you should feel a good stretch there. All right, so that's going after the gastroc. If we want to go after the soleus, instead of keeping that back leg straight, what we're going to do is we're going to actually drop that back knee and try and drive it to the floor. You should feel a stretch a little bit lower in that ankle. Okay, you're going to hold this for 30 seconds. I'm doing 3 sets. For time purposes, we're just going to be doing 1 set. Okay. Once you guys also switch to the right side, do the same thing. Okay. Foot should be pointing straight ahead, heel flat on the floor, and you're driving that back knee towards in the direction of the floor. Good. All right. And then you guys can also foam roll the calf. That's going to be beneficial too. Okay. The best way to loosen up muscles is a combination of stretching as well as foam rolling. All right. So that's the ankle. That's going to help with that. Now we also want to go over how to stretch out the quads. All right, so what we're going to do is we're going to do a technique called the couch, or a stretch called the couch stretch. So what I want you guys to do is you can use your couch, okay, that's the name of the couch stretch, or you can use a Bosu ball, not a Bosu ball, sorry, a TheraBall, or something just to prop that back leg up. This is going to be I think this chair is going to be a little bit too high for me. We'll see. Okay, so what we're going to do is I'm going to use this as my couch. Okay, what you're going to do is you're bring your leg up onto that chair. Okay, and then we're kneeling down. Okay, we should feel a nice, pretty intense stretch in that quad, keeping everything upright. Okay, you should feel it down here. This is going to help a lot with knee pain, especially if we're thinking that the quad is contributing. Okay? So you're guys like, what's the difference between this really and the other one I showed you guys for the hip? So by bending this knee up, now we're able to target the quad versus the hip. Okay, now we're getting that quad. If I take this chair away and put my leg down, now I'm hitting that hip flexor versus that quad. Okay? Alright? So we want to be ideally, again, doing 3 sets. All these stretches I'm showing you guys today should be held for doing 3 sets, 30 seconds. Okay? Any questions on the quad stretch or that hip flexor stretch at all, guys? All right. So now we're going to do, lastly, is we're going to go over, I'm sure usually a lot of people have a lot of lat tightness. So what we're going to do next is we're going to go over how to fix that lat tightness. Okay? So you're going to need a foam roller. If you don't have a foam roller, that's okay too. You can do it without one. So what you're going to do is you're going to grab the mat here. Alright? And what you're going to do is you're going to take a foam roller. You can also use you can go on a hardwood floor and take like a towel, okay, and put it underneath your hand. And what you're going to do is you're going to take with your thumb pointing up, and then you're going to reach overhead, okay, and then hold there. You should feel a nice stretch down in that armpit area, okay, in that lat. Okay, and come back up here and do that again in position. You can hold this for 30 seconds. That's going to help out that lat. Again, it should not be painful. Focus on deep breaths. And you're going to do the same thing on the other side. So that's the one, in my opinion, one of the best lat stretches. Okay, it's going to help free up that lat. Okay, and get your shoulder moving a little bit more effectively and efficiently. Okay, so to recap, I know we went through a lot today. I don't mean to overwhelm you guys. All right, so went over the calf stretches, the quad stretch, the hip flexor stretch, and the lat stretch. Those are the top 4 muscles that we've seen across the board where people are having tons of tightness. Okay, we addressed all those today. All right. Again, make sure that if you're having a pain or injury that you're getting this assessed and checked out by somebody. Okay. We just barely scratched the surface on the assessments that we use as physical therapists. There's hundreds of other tests that we use through an evaluation. These are the most basic ones, and ones that you guys really don't need to have a whole lot of background or medical background to be able to conduct, to at least start giving you some insight into things. Okay? All right? But this is an end-all be-all. It's not like, oh, because I had quad tightness, that's 100% of the reason why I have knee pain. Or I had ankle tightness, that's the reason for my knee pain. There can be so many other contributing factors into things as well. Okay? But again, at least I wanted to give you guys at least some start to some answers on what's going on with your body and why you're having some pain, and then also give you some actionable things that you can start doing to make progress. Okay? So these should all be feel-good exercises. They should not be painful. Should all feel pretty good. All right. So if you guys are dealing with pain or injury, this isn't something that you need to be dealing with. Okay? Especially when there's a solution. All right. This is something that these musculoskeletal injuries, knee pain, shoulder pain, low back pain, ankle pain, you name it, neck pain. This is what we specialize in helping people get through, okay, and overcome. We hear all the time. We hear it literally every single week. They're like, patients come in like, I can't believe I literally let myself deal with this pain for over a year, sometimes 5 years, sometimes a decade. We have people that say they've been in pain, and now that they're out of pain, they're like, I can't believe that I literally lived with that pain for that long and never did anything about it. Okay, they're like, holy crap, I missed out on a lot on my life because of that pain when there was a solution the entire time. People are just kind of shocked. And I want you guys to know that this isn't, you can live your life without pain. This isn't something you have to be dealing with. You can get back to running the way that you want to. You can get back to exercising the way that you want to without having to make modifications. You should be able to do all those things and not have to avoid certain things throughout your life because of an injury. Okay? All right? So there is a solution. I'm happy to help you guys out. All right? And because you guys came to the workshop today, we're doing something special for you guys. We're giving a full initial evaluation, 50% off. You guys are like, okay, well, what is physical therapy and what can I really expect with that? All right. So initial evaluation, what we do is we go into much more in-depth screens of the ankle, of the knee, of the hip, low back, and shoulder, and see what's really going on and what the root cause of all this is. Okay, and get some answers. So we do a full body biomechanical assessment. We do strength assessments, range of motion assessments, functional movement screens. So looking at, like if you're having pain with squats, we do a video analysis of squatting. Figure out, hey, where are some deviations, deficits, and then correcting those. If you're having pain with running, we do a running analysis. Okay, whatever you're having pain with, we usually do a video analysis of it, break it down. Is it the technique? Why is the technique breaking down? Is it due to mobility restrictions? Is it due to muscle weakness? And figuring that out and then addressing those and making critiques to that. For some of you guys, you guys may have been to PT in the past, but I want to assure you not all PT is the same. Traditional PTs usually go in, you see a physical therapist for 2 to 3 times a week, and you spend maybe 15-20 minutes with the actual physical therapist, and then you're handed off to an aide or assistant. In my opinion, just doing exercise that you'd be doing at home with us is quite a bit different. Every session is going to be with one-on-one for an entire hour with a doctor of physical therapy. And because you're with a doctor of physical therapy the entire time, during the first half of the session, we're able to do a lot of hands-on manual therapy, massage therapy techniques to help loosen up those tissue restrictions, get you feeling better. And then the second half is making sure we're going through exercises that are going to help reinforce the changes that we made with our hands and give you the education, the tools to allow you to be independent. We don't want you relying on having to come in and see us to get pain relief. We want to give you all the education and tools and exercise that you need to continue to make progress. With that being said, patients don't need to be coming in 2 or 3 times a week. Patients just come in once a week. We give you an extensive home exercise program. As long as you're doing that, there's no reason you need to be coming in 2 or 3 times per week as you would with typical physical therapy. Every time that you come in, we're not going to waste your time coming in and doing exercise that you could be doing at home. Every time that you come in, there's been about a week gap between sessions. You should have made progress over that time with exercise that we gave you in the past. And next time you come in, we're leveling up those exercises and making it more difficult. Okay? And with the goal in mind of getting you back to whatever activity that you're trying to get back to, whether that's running, whether that's CrossFit, rock climbing, boxing, you name it. That's our end goal, and keeping that in mind. So every time you come in, that's what we're working towards. And then we have a 3-step process. Our first phase, obviously, want to decrease the pain and symptoms that you guys are experiencing. And the second phase is once those pain and symptoms are under control, we want to get to the root cause of this. And that's the real secret, okay, is getting the root cause of things. And then phase 3 is making sure that your body's stronger and more resilient. So there's a much less likely chance of this occurring again in the future. Okay, so that's kind of how physical therapy works with us. And if you guys want to take advantage of 50% off initial evaluation, start getting some answers, I'm happy to get started. And what you guys can do is you guys can fill out the link below. I put it in the comments. Just fill that out. And what we do is we hop on a phone call for 10 to 15 minutes, figure out, is this something that even needs physical therapy? And if so, what we need to do and what the route looks like. Sometimes people call and what they're able to do is it's not a pretty minor issue, and I give them a few exercises and usually it takes care of it. And if it doesn't, then you come in for an evaluation, but I'm not here to waste your guys' time. Okay? So you guys take advantage of that. I'm happy to speak with you guys on the phone and point in the right direction with that as well. All right. Well, hope you guys that's all you guys got for you today. Again, I'll be uploading the routine to the group here shortly. By the end of the day, you guys should have that. So, but yeah, I appreciate you guys attending today, and I hope you guys found it beneficial and whatnot. And then I'll be seeing you guys next week. Hope you guys have a great rest of your week and a great weekend. All right, bye guys.